first question is a little bit of a long one, so I'll read the whole thing here. She is an OT working in acute and inpatient rehab, and she's also the primary caregiver for her mother who has end-stage COPD. She's also an only child. Her father recently tested positive for COVID. Fortunately, his main symptoms were cognitive impairment, which is cleared for the most part, and he did not require hospital admission. However, during all this time, she noticed how often she is bracing for impact. So throughout her mother's extended illness over the years and her father's varying health, she doesn't think it ever occurred to her how this affects her and the way she is able to show up for her loved ones. And she doesn't think that being a health professional helps in these moments, as she thinks that seeing the worst case scenarios can't help but make her think of these situations with her own family. So she's thinking about keeping your knees bent and remaining flexible, and letting go might actually allow her to be more present and available. And she's wondering how palliative care may support the caregiver and the family unit and all of that. And a quick note, I'm hoping, BJ, you can define COPD and OT in your answer as well.
Okay, so let's break this down. So first of all, thanks for that question. There's a lot in there. So let's see if we can break it down. So first of all, OT stands for occupational therapist. So occupational therapist is a little bit similar to physical therapy. You'll often see PT/OT departments, and some folks have training in both physical therapy and occupational therapy. Occupational therapy tends to be more of the mind-body connection, cognitive, languaging, communication, fine motor movements, etc. So occupational therapy is a very important piece of the rehabilitation world. So beautiful. I love OTs. I've benefited mightily from you folks over the years myself. So thank you. Oh, and then COPD stands for chronic obstructive pulmonary disease. COPD is a disorder of the lungs, a chronic illness of the lungs, not curable, but manageable. People can live with COPD for years. It's not uncommon as a fallout from prolonged smoking or exposure to toxins, but there are other reasons too. Non-smokers get COPD as well. And the way it's experienced is a shortness of breath. And so sometimes folks with COPD at the end or later stages will be on oxygen. And you may have seen folks walking around with oxygen tanks and the little nasal prongs. So that's COPD. Okay.
And then let me just refresh you on the question here.
Sure.
So thanks. She's thinking, she's talking about bracing for impact and kind of keeping your knees bent and being flexible, and how that mindset of being flexible and letting go might actually help her be more present and available. And then on top of that thought, wondering how palliative care can support the caregiver and the family unit in all that.
So let's start the second part. So yes, so palliative care, reminder, palliative care is interdisciplinary care. It's concerned around quality of life for the patient and caregiver. If you look up the definition of palliative care, it says the unit of care, excuse the lame language, but the unit of care, the subject of the care in palliative care is always the patient and family, or patient and caregiver, patients and friends, the inner circle of the patient. Because we know that people don't experience these things in a vacuum. We are affected and we affect our inner circle. And so you're all a piece of the puzzle as far as palliative care is concerned. So technically, as a caregiver or family member or friend who's close in, you should have just as much access to palliative care as your patient person does. Practically speaking, that's not the way it goes so easily because of insurance designation. How do you schedule an appointment as a caregiver and how does that get billed, et cetera? So it can get a little wonky. But know that at least in the philosophy of palliative care, caregivers are expressly part of the puzzle, not an aside, front and center piece of the puzzle. I'll remind you, you might not find a palliative care program that you could have in your local clinic that have a visit with. Maybe you could, it's worth asking. But you're always welcome to us at Mental Health. And I mean this not as a plug for mental health, but just to say the bulk of our clients are actually caregivers. And because there's no need to go through insurance or a doctor's referral, you can sidestep the logistics of the healthcare system.